Good morning. I'm Michelle Larkin. I'm the Assistant Vice President here at the Robert Wood Johnson Foundation, and I wanted to talk with you a little bit about health and how we think about health here at the Foundation, and we hope to shift the national debate around health and prevention and wellness. So it's easy for folks to understand healthcare, right? You get sick, you go to the doctors, you get treatment, you go home and you feel better. But what about folks who can't access a doctor? What about folks who are actually have chronic diseases like diabetes or hypertension, or there's been a lot in the paper around childhood obesity and how kids are overweight and that problem is continuing to grow. For those kids, it might not be so easy for them to access a doctor, but wouldn't it be great if we could stop it before it happened? Wouldn't it be great if we actually thought about health as what we were trying to sustain and maintain versus health care, where we're trying to treat people after they've already become ill? So health, it's really about feeling good. It's your quality of life. It's thinking differently about how we bring together sectors, business sector, faith-based organizations, our traditional government agencies like public health departments that inspect our food in our restaurants. And it's also engaging the education system, because what we're seeing is that health is much more than just about whether or not you access the medical care system, but that health is about, are you actually able to live somewhere, be able to play, be active, have a job, and all of those things are in part determined by the multiple determinants of health. What is that? So it's a very jargony term, but what it means is that education, your health behaviors, like whether you smoke or drink or eat a lot of fatty food, whether you graduate from high school, whether you have a job and can actually afford to buy healthy food for your family, whether you live in an environment that's filled with toxins, like are you living near a plant that is pumping out lots of pollution, or living by the highway. And I'll use a concrete example. Maybe you have a child with asthma, and that child, you're giving them their medications, you're taking them to the doctors, but you're living in a house that is right by the highway, and so they're exposed to those fumes every day, which doesn't help their breathing. One of the things that health is about is thinking differently about where we put highways and where we put housing, and making sure that we're actually thinking about how transportation might impact our health. I'll use another example. This is from Wyandotte County, Kansas. Joe Reardon's the mayor there. We had done a ranking called the County Health Rankings, where we ranked all 50 states, counties within them. So it wasn't comparing state to state, it was comparing county to county in a state, on things, health behavior, health care, socio and economic, things like education, employment, and environment. Wyandotte County was the worst out of all the counties in Kansas. And Mayor Reardon took a look at it and said, how are we doing so badly? We have some of the best medical institutions in the state right here, and yet people still aren't healthy. He was also bringing in a lot of jobs and thought, well, I'm doing a great job of bringing in jobs, but my folks still are low on employment. And there were a lot of community education programs going on, but they weren't seeing an increase in their graduation rates from high school, or people who were graduating getting the jobs that he was bringing in. And this was all coming together to give them a low ranking. So he brought all those folks together to start thinking differently about health. One of the things that he talks about is discovering that they were trying to bring in grocery stores to their community because it was a food desert. And for those who don't know, a food desert is when you don't have access to a grocery store within X number of miles. He could bring in a grocery store, but none of the public transportation that people in his community could access actually went anywhere near where that grocery store was going to be placed. Hard to be healthy and make good choices when you can't actually get to the store to do that. So another example to get you to think differently about just approaching it from the medical system. Somebody has diabetes. You come in, you have a child who has diabetes because they're obese. Your doctor says to you, check their blood sugar, which you do, and buy more fruits and vegetables and reduce the amount of calories that they take in. You are on, you have a limited income, you have 2 jobs, and you go back to your community, and you don't have a grocery store in your community. Not only that, that limits how you can access fresh fruits and vegetables, because all you have is a corner store and all they sell is macaroni and cheese or potato chips, and that's not good for your child to eat. You want fresh fruits and vegetables. You also have been instructed by the doctor to make sure that your child gets out and plays. You live in a community that has a lot of violence, and no lighting, no parks, no sidewalks. It's not safe for you to be out on the street with your child playing after school hours. So you want to do the right thing, but because of the way that we've constructed our communities, we've thought about health as just being, go to the doctor, do what the doctor tells you, and you'll be well. And what we really need to do is shift that to think about how we create healthy communities where you can make active choices to be well. You can live in a community that is violence-free. You can live in a community that has parks where you can go and exercise. You can have access through public transportation or through your own private vehicle to a grocery store that has affordable, fresh, and nutritious foods. These are things we don't necessarily think about in this country. So I would encourage you, as you're thinking about innovations to contribute, that you think differently about health. You don't think about it solely from the medical care system. Don't get me wrong, very important that we have treatment and that we have access to nurses and doctors who can help us recover our health. But it's so much easier to maintain health once we have it. So when you're thinking about innovations, think about ways that you can construct communities and make it easy for people to make healthy choices. Think about smoke-free air laws as a way, as one example, which is not terribly innovative because we've been doing it, but back in the day when we started, it was an innovation. People thought, you cannot do this. And we've been able to move forward with clean air. We've also been able to show that medical costs, heart attacks, go down in a community that has a smoke-free air law and offers cessation services and a way to help people quit. So there is a financial benefit to getting to doing innovations like that. So innovations that you might want to think about. How do you get health to be part of policy decisions in areas that are outside of health? Think about transportation. We think about that as getting from here to there. And how do I get the most people to move in the safest manner from here to there? Well, what if we actually thought about transportation as active transportation? And how can I make sure that people are connected to where they work? They're connected to places to exercise. They're connected and can readily access education facilities, community facilities, without having to get in a car. I'm not opposed. I love my car. I do. But I have been able to choose to live in a community that allows me to walk. Having transportation policies think about health and the impact will be important. I'll use an example here in this country, which is how we design suburbs. We moved people out of the cities. They chose to move to suburbs. The suburbs are constructed that they are closed. They can't actually walk to any stores or to their jobs. And now, unfortunately, we have a society where people spend hours commuting to and from work. So we're moving back to thinking about using multi-use zones for places where people can live, they can shop, they can work, and they can access it all by foot traffic, which has benefits to the environment. Another type of innovation to think about would be thinking differently about business. We all want to have economically vibrant communities, and business has a role to play. A lot of businesses are thinking about how to help their employees be well, and they're thinking beyond their employees to the employee's family. I think that's really, there are lots of innovations that could be tested and tried with how to create a partnership where business is located with the community in which they're located. And I'm not going to tell you what's the right way to do that. That's for you to tell us and to give us your creative ideas. I'll give you an example of Rebecca Oni, who is one of the folks here in this country who created Health Leads, which one person working to make changes, which all of those things that I talked about, making sure that folks who are coming into the medical system with diabetes or obesity issues or hypertension, but they're also having challenges with the neighborhood in which they live that doesn't allow them to exercise. Rebecca created a program called Health Leads that actually physicians, nurse practitioners write a prescription to that patient to say, eat nutritious fruits and vegetables. Person takes that prescription to the Health Leads desk, and volunteers help connect them to community services to be able to do that. One person making the change, connecting to volunteers, and those volunteers are not creating new services, but connecting that patient to the services that are already in their community so that they can access them and have the benefit of them, which doesn't always happen, right? We see our doctor, we get told, eat healthy, exercise, and then we think about the reality of our lives. I don't have the resources, I don't have access to a grocery store, I don't have any place to exercise, not realizing that there actually are some of those things potentially in our community, and this is a way to make those connections. Another one is a story that I just heard a couple of weeks ago around domestic violence. And I think it was in India, which they started a program around stopping domestic violence, being very appropriate for that culture, which is instead of interceding and potentially which is something that is not comfortable directly in a confrontational manner, to ring the doorbell. When you hear a domestic dispute going on, just go up to the door where you hear it, ring the doorbell, and what I've heard is that that's been successful in getting people to stop and realize that they are, their neighbors are hearing them and that what they are doing is not acceptable. Again, a small innovation. We need research to tell us whether or not it actually makes a difference, but these are things that individuals can do. Think about your role that you play in the community, especially if you're a small business owner. You know, how are you helping your mayor or your leadership council in your community think about the importance to you being a successful business person, but also what's the responsibility back to the community? How can you help to make sure that you're getting the educated workers that you need, that you're getting the healthy workers that you need so that they're not out sick, and thinking about ways to do that. Could be something as simple as making your business tobacco free, making your business, talking with your community about how putting in sidewalks so that folks can walk to work and don't have to cross a really busy road and risk their life and limb to get to you. whether that's your employee or your customers.